Okay, we've got an opacified lens here. This is a hydrophilic lens with a hydrophobic coating. The patient had a DMEK. That's not the correct lens to put in a patient with that condition. Obviously, I didn't put it in there. Okay, so we're going to take this lens out today. You can see the very dense central opacification with presumably the SF6 gas came into place with the lens. Hydrophobic lenses should be used in cases where patients are going to need gas in their eye. I've done a meticulous visco dissection, cut the lens in two, and then just slowly and delicately twisted that haptic out of the capsular bag to ensure there's no zonular stress. It's very important to do that part with viscodilation of the bag, viscodissection of the lens from the capsule, and then just very slow and delicate removal of the lens from that equator of the capsule, as you can see I've done there. And that last bit of lens is removed. A new lens goes in, nice clear Alcon hydrophobic lens, so there's no risk of further opacification with further DMEKs or intraocular surgery involving gas. Wounds are hydrated, case done, excellent efficient.